Hello, my name is Dr. Jimmy Zhou, and before attending the Stritch School of Medicine for medical school, I obtained a bachelor's degree from UCLA in biological sciences. My current specialty is emergency medicine. I do hope to do a critical care fellowship after emergency medicine residency, and what that entails is ICU level training that will allow me to practice both in the emergency department and ICU after graduation. While I was in medical school, I was the vice president of my class, so I participated in the class board where I helped shape policy for medical schools, which included attendance policies, and we were essentially a liaison between the students and school administration. In addition, I was president of the emergency medicine interest group, and I helped cultivate students' interest in emergency medicine and also helped hold a lot of info sessions and workshops as well. So I think the key to success in medical school is really paving your own path to medical school. There's many different ways to get there, and what's really important is that you have a passion that is tangible and a passion that you yourself understands, because this process of applying to medical school and medical school itself is really tough, and everyone needs to really find their own path to get to that, final acceptance point. I think my approach to medical school counseling is somewhat different from other people. I think instead of the traditional advising or traditional, focus on numbers and activities and checklists, I like to tailor my counseling to an applicant's specific strengths. So for example, if an applicant has strength in the arts, I like to connect the arts to medicine. If an applicant has, a strength in working with the underprivileged population or the homelessness community, I like to play to those strengths as well. I think, again, like I mentioned before, I think everyone has their own path to medicine, and I like to make the best of that and help students kind of capitalize on those types of strengths that they already have, instead of trying to make everyone into a cookie cutter dream applicant. I think there's some value in knowing that even though the path to medical school might not be super linear, I'm someone that likes to instill hope in a lot of those students and let them know that's going to be okay, and that the best thing we can do is selling ourselves to these schools. One of my greatest strengths is that I have served on the admissions committee of my school. I think I have an intimate view of what people look for during these admissions meetings, especially in applicants. I've also helped counsel many students, a lot of them having been counseled during my time as an RA at UCLA. In addition, I think, I really have a passion for helping students in mentorship. One of the things that I do a lot, even in medical school, is mentoring med students, both, academically and also from a career standpoint. I always like to say I'm the mentor that I wish I had, because I think giving direction to the next the future med students, the future of doctors in America is so important, because without proper mentorship, it can be a really challenging journey. In short, I'm passionate because I used to be a pre-med student. I used to be somebody who wish I had the help that, I could give to these students. It's a really long journey, and it's really tough for people who have never been in medicine, or who've never had a family member or sibling in medicine. I think, it's important to give back to the community and to, give back the knowledge that I gained from my own time as a pre-med.